So the outline for this part 2, and this one's going to be the one that you're going to be happy to hear. It's going to finally be something useful for you. And I want to start off too by saying I had my own radiology experience 6 weeks ago. I also had a venipuncture experience 6 weeks ago, pre-op. And needless to say, fortunately for me, I got a nurse who was willing to step by step listen to my instructions. So it only took 2 sticks to get me. First one, of course, the nurse wouldn't listen and it was a failure. The second one, step by step, did what I told her. We were in and I was off to surgery. So it's critical that this procedure, this venipuncture, we need to get it right on the first stick so that patients have confidence. They are as relaxed as they can possibly be in an already scared situation. We have to minimize the trauma drama. So let's go on to the next slide and we'll get started here. First off, this palpation technique, again, I don't have my new set of slides because that is not the picture I would have put there. My technique is all about gentle, gentle, gentle. So I want this gentle little finger touching something very gently. I don't want you to have this impression at all that we're going to do anything mean, because we're not. The tourniquet is mean. This new palpation technique is not. But we're not going to look for a vein. We have to feel for this vein. So using our sense of touch, not our sense of sight, we're going to feel for a vein. When we use our sense of touch, I promise you 100% of the time you will be able to locate a healthy vein. You're going to be able to dilate that vein without the tourniquet. And then we're going to grade the vein, which is a brand new concept. We need to know that that vein is going to tolerate the stick and the infusion of contrast. We don't want a vein that's going to rupture upon venipuncture. We don't want a vein that's going to leak contrast. So grading this vein is a new concept and we're going to go into it in detail. So we're going to palpate to locate, dilate, and grade. So the new palpation technique, do not look. 3 inherent problems if you try to use your eyes to locate a vein. Number 1, you can't always see one. The veins are deeper in the tissue or the skin is too dark. Number 2, again, you've heard the expression, you can't judge a book by its cover. It means you have to read the book. Well, you can't judge a vein by its appearance either. Well, how do you read something you can't see? Well, how does the blind man read? By feel. And we need to also know that not all veins are created equal. So even if you could see one, you still don't know anything about that vein. Is it going to tolerate the stick or not? So this new palpation technique solves those problems. We're going to be doing this new palpation technique with the pad of our dominant hand index finger, 70% isopropyl alcohol, and we're going to palpate wet. So let's get into the detail of this. First of all, it's the dominant hand. Your brain is wired to one hand or the other for dominance. And don't tell me you're ambidextrous, because if you are, I'm going to promise you, you're right-handed. I'm sorry. If you think you're ambidextrous, you're really left-handed. But anyway, you need to determine which brain dominance you are, right or left, because it's the dominant hand that has to locate, dilate, grade, and access that vein. Now, that pad, not the tip, the pad, is sensitive, specific, and you're going to be accurate. So with sensitivity, specificity, and accuracy, use the dominant hand index finger. Now, do not poke. That's a whole different feel or touch sensation to the patient, and it's not going to have a good effect. It's going to have an adverse effect. The other thing, when you're feeling, you need to open up the entire hand and feel. Okay. Just do it while you're sitting there. Make the fist and do this. Even if you're touching, there's still more of a poke or too much pressure sensation. But if you open up the entire hand and relax, and now you do this, now you've got a gentle touch. And that's what we're looking for. Gentle, gentle, gentle. So feel using the pad of your dominant hand index finger, not the tip. And we're feeling for the long, skinny water balloon. No other structure in the human body feels like a water balloon bounce except the vein. And that's why I've used this tool as the analogy for what you're feeling for. So you should be thinking, well, that'll be pretty easy. I can't make this arm work right, but veins in the arm, you're going to be feeling for water balloons. A not over distended water balloon. Now, here's the video on that. So take the pad, you're probably sitting at a table or something that has a surface nearby. Use your pad and place it on that surface, okay? Just the pad. Because if you drop the arm or any other part of the hand onto that surface while you're feeling, your brain is going to get a touch signal from all those other spots. We're going to see that. And now the brain goes, dang, I have to filter out all that other information. So make sure just the pad is touching. Now, if you had a water balloon sitting in front of you, so visualize that. When you place the pad of your finger on that balloon, and very gently depress, release, keep the skin, keep the finger in constant contact. You can't lift off because now you're just tapping. We don't want to do that. We're depress, release. It's the rebound information that's important to us. That's going to tell us everything we need to know about that vein. Okay, so that's what we're feeling for. Now we're going to move that little vein, that balloon, and we'd normally move the finger to get in alignment with the vein. Right now I've moved the balloon to get in alignment with the finger. But when you get in alignment with it, now you can feel the vein the entire length of your pad. Now you know what direction the vein is going. That's going to be huge when you go to insert the needle. Be nice to have a little bit of vein to work with instead of a cross-sectional portion of it. So we're going to visualize and think of the long skinny water balloon. Now I want you to look, the actual image. I did this cadaver dissection to demonstrate what the vein really looks like, because most people in allied health never get that opportunity to see that. So the skin's been dissected away, and you can see that the vein sits in subcutaneous tissue, and depending on the person, how much subcu there is. But that vein, and it's kind of hard to visualize here, and perhaps you can get to the website and see it a little more clearly, but the vein is very thin, very flat when there's no blood in it. And in fact, it's white with no venous blood in it, but it's identical to a long skinny water balloon that has no water in it. And that's why you can use the water balloon as the analogy. Now, so with this palpation technique, then we're going to use the pad of the dominant hand index finger, feeling for a long skinny water balloon, and using alcohol to improve our sense of touch. We're going to come to that. Sorry, got ahead of myself. Use the pad, feeling for a long skinny water balloon. Next, we need to improve our sense of touch, and we can do that. So with this, we're going to use physics and chemistry to tell this part of the story. When you palpate dry, skin on skin, and you just can't do it with a glove. So trust me on this, skin on skin. And you can't do it on yourself, by the way. You'd have to feel somebody else's arm. But when you palpate dry, you can probably feel some grab and drag. Okay, that grab and drag is called friction. And friction is noise to the brain, tactile noise, so you don't have a clear touch signal. Well, alcohol, 70% isopropyl alcohol, the alcohol that's already found in every wipe out there in the world, even though their wipes aren't wet enough. 70% isopropyl alcohol prevents that grab and drag. It prevents friction, and now it glides. It's amazing. And now you have a clear touch signal. So we need to wet the region first before we palpate for those veins. So here's an arm, and before you, I would like for you to palpate dry. So before you wet it, take that finger and go across the antecubital region back and forth and feel the grab and drag. Because this is an obvious vein, and that's the kind of arm I want you to get initially. A vein that's not only palpable, but it's obvious, it's visible. So when you glide with the alcohol, now you discover, wow, it just really sails across there. And that vein, when you palpate it dry, you could feel a bump. But when you palpate wet, it feels bigger. It's not, but it feels like it is. And you can tell how tall it is, how wide it is, and where it ends when you're using alcohol. So first glide dry, then wet it and glide wet, and then notice the difference. And then press palpate to feel the water balloon bounce. That's how to locate a vein. And so for the deeper ones, you're still going to glide initially. There's 3 types. We're going to come to that. The first 2 you glide palpate. The third one's a little deeper in. We're going to press palpate our way across, feeling for the water balloon bounce. Now, why do we palpate wet? Well, because of the friction. We can't have a noisy touch signal. You won't have a clear impression of the structure. And I want to tell you that static on the car radio, that's audio noise. So friction and static are in the same physics category. And then TV before satellite and cable with all the snow, that's visual noise. None of those are fun. And none of those are clear. So again, we're going to palpate wet with 70% isopropyl alcohol. Now, if the patient is concerned about you touching them with your skin, just remind them that the same alcohol that's prepping their site is prepping your finger. And at this point, we're merely going to feel for a vein with this technique. If at the point of needle insertion, your facility wants you to use some other prepping agent besides 70% isopropyl alcohol, something like chlorhexidine gluconate or maybe betadine, you will. But we're doing this for the purpose of locating veins. So prep the skin, prep the finger, and ungloved, you're going to feel for those veins. Now, if you have access to a vein block, that's another great tool to experience this friction and then no friction experience, okay? When you glide dry, you definitely feel the grab and drag. You feel 2 bumps. When you wet it, now it sails, and now those bumps, you can tell one is bigger than the other. You've got all the detail about them. But if you don't have a vein block, use the human arm. That's what we're working with after all anyway. So that's how to locate a vein. Use the pad of the dominant hand index finger with 70% isopropyl alcohol and a gentle glide palpation first and or a gentle press palpation. But remember, not all veins are created. We don't want just any vein. We need to determine if it's healthy, so we've got a little more work to do. Let's keep going. Now, there's more to the anatomy than just the vascular diagram. And again, I want to remind you, when Gray drew these original diagrams, he had no idea somebody was going to be looking for a vein to put a needle into it. So it's up to us to take the anatomy information and apply it to what we're doing. So we want to know about the anatomy of the vein itself, the structure we're about to put a needle into. And so that's the detail that we're going to go into next. Again, I want to remind you, the vein, the true cadaver depiction there on the left, feels like that water balloon. So keep those images in mind as we do this anatomy detail of the vein that we're going to cover. First and foremost, anatomy means structure. Engineering and common sense tells us that all structures have limits. All structures have structural limits. So does the vein. So we're going to talk about the lumen of the vein, the thickness of the wall, and the fact that it's innervated. So the lumen. The lumen of the artery is always very small and perfectly circular. The lumen of the vein is very large, holds lots of blood, and is pliable. It can be circular or it takes on whatever shape it's sitting next to. And that's why when you depress the balloon, it's no longer circular, right? But it's pliable. Okay. Next, the vein wall, very thin compared to the thick arterial wall. One of the physiological reasons for that has to do with the pressure of the blood in those vessels. Recall, the pressure of the blood in the artery is 120/80 or 80 to 120 millimeters mercury pressure. The pressure of the blood in the vein at that exact same region is only 10 to 20 millimeters mercury pressure. Now, all vessels, arteries, and veins have 3 layers of tissue. The inner layer, which is blue on this diagram, is called the intima. It's a thin layer of connective tissue, thin like your skin and similar to your skin in its consistency, but thin. The outer layer, purple, is the adventitia. Same thing, thin layer of connective tissue. It's the middle layer that's the most important in both vessels, and it's called the media for the word middle. And it is all muscle, smooth muscle to be exact. 3 types of muscle in the body: cardiac, smooth, and striated. Smooth muscle can be found lining the gut and blood vessels, and that's all that they teach in any of the allied health programs. And you spit it out for a test and you forget it. Well, here's the importance of that information. That muscle can contract or it can relax. So let's talk about it, but also want to remind you, these anatomical structures have limits to how far they can be stretched before you tear the muscle, aggravate the nerve, interfere with the blood pressure in that vessel. So, quick reminder again, the big lumen of the vein with the thin wall makes our vein identical to the long, skinny water balloon in touch sensation. Now, we know that the wall has a muscle. Why did that do that? I'm going to try and get rid of that. There we go. Okay. The wall of the veins and arteries are also innervated. They have nerve endings. This is huge. We know this because Sir Henry Gray told us this in 1858. Veins are supplied with nutrients, vasa vasorum, like the arteries. Nerves are also distributed to them in the same manner as to the arteries, but in much less abundance. But nevertheless, those veins have nerve endings, just like your skin. And we can feel hot, cold, touch, and pain. So can the vein. We react to hot, cold, touch, and pain. So does the vein. So let's look at this in detail. There are our 4 stimuli. We know from Biology 101, heat dilates. So I want you to think, you just crawled into a whirlpool, hot tub, or sauna, and a comfortable warm, not one that makes you want to get out, a comfortable warm. When you get in, the heat tells your nerves to tell your muscles to relax. Okay, everything relaxes, and the vein wall relaxes, and consequently the vein fills. Cold. Outside, snow, 0 degrees, but we're going out in a swimsuit. Do we get out there and go, give me more? No. Give me less. Cold constricts. Gentle touch. When you go to the massage therapist, what's the purpose of massage? And hopefully you go to a nice one, gentle one. Purpose of massage is to relax. So that muscle in the wall of the vein will relax and then allow for distension. Good. If you use pain, if you smack, slap, flick, or tap, pain causes constriction, not dilatation. Okay, so we don't want to do anything that's going to cause constriction. So if you smack, slap, flick, or tap, expect the vein to get small. Now I know what you're thinking. Well, it doesn't always shrink when I do that. Well, that's because you've got that mean tourniquet on and it forced an over distension and it can't constrict. So now the brain's in conflict because it wants to constrict. But if you will just take a normal sitting vein and flick it, you are going to see it shrink. Biology 101. So what makes everything relax? Heat and gentle touch. And again, we don't want to think of a flame. When we think of warm heat, I think of a hot tub, whirlpool, or sauna, okay? But we don't want to use heat. It takes time to heat something up. You'd have to heat up a wrap or some application. And then how hot do you get it? And then the risk of burning the patient. And then the fact that you made the entire area red, hyperemic. We don't want that. I want one segment of vein to dilate. So we're going to use gentle touch. Well, gee, what were we doing when we were gliding to locate the vein? Gentle touch. So the exact same gentle touch technique is going to dilate this vein. So gentle touch naturally dilates the vein to the size nature wants it to be, not bigger than, which is what the tourniquet does. So a natural dilatation to the size nature intended, without a tourniquet, without pain, and in 7 to 15 seconds. And it's confirmation that you've located a vein if it dilates. But also we've maintained the integrity of that vein wall, the integrity of the nerves, the integrity of the muscle, and the blood pressure has remained normal. All of those things will keep the vein and venous system normal. Remember Starling's equilibrium? If you over-distend that and overstretch that and fill it with too much blood, the blood pressure goes up, the wall thins, and the system begins to leak from the vein, the venule, and the venous part of the capillary membrane. So by doing gentle touch, we maintain the anatomical and physiological integrity of that system. So again, tourniquets don't just dilate a vein, they force an overdistension. Whereas gentle touch But compare. You want a mean tourniquet or you want gentle touch? If you were the patient, which would you rather experience? Working with the patient, which would you rather do to the patient? So we palpate then to dilate. We palpate to locate. We palpate to dilate. Pad of the dominant hand index finger with 70% isopropyl alcohol, feeling for the long skinny water balloon, staying on it when we locate it and continuing to palpate it till you feel the muscle relax, and then you feel the vein start to fill, and then it reaches a point and it stops. Confirmation, that's a vein. So let's go back to that same arm. Now you're going to palpate dry just for the experience and go, yeah, that's not good. Wet the region, leave it wet, dripping wet with alcohol. It'll evaporate. It's alcohol. Glide first, because 80% to 90% of the vessels you and I are going to have to locate, whether it's antecubital or wherever, are going to be palpable by gliding, because they'll be that close to the surface. If you can't feel it by gliding, start at one side of the antecubital region or the other and press, palpate your way across. And I mean go full side. One lateral or medial, not just in the middle. Lateral, medial, the entire region, because veins can be anywhere in there. Do it wet, feeling for water balloons. And then when you locate it, continue to palpate it to dilate it. You're going to be so thrilled with this technique. It's just, it'll tickle you. And it's amazing. Anybody can learn this.